The thorax is auscultated systematically by valve area. With the dog standing on 4 legs, the mitral valve region is just dorsal to the left caudal sternal border from intercostal spaces 5 to 6. The pulmonic valve region is located by moving the stethoscope cranially along the left sternal border to the 3rd to 4th intercostal space. The aortic valve is just dorsal to and slightly caudal to the pulmonic valve at the middle third of the thorax. The tricuspid valve sound is best heard at the junction of the middle and lower thirds of the right thorax near the 4th intercostal space. Normally, only the first and second heart sounds are auscultated in the dog. The first heart sound, which coincides with closure of the mitral and tricuspid atrioventricular valves, is best heard over the mitral and tricuspid valve regions. The second heart sound coincides with closure of the aortic and pulmonic valves when the pulmonary, arterial, and aortic pressures exceed the corresponding ventricular pressures. The second heart sound is clearest and loudest over the aortic and pulmonic valves. Sinus arrhythmia, a normal variation in cardiac rate, is related to respiration in dogs. It is heard in most of the sounds recorded. Listen to the normal heart sounds of a dog heard over the mitral valve region near the left 5th intercostal space at the sternal border. Note the lower frequency of the first heart sound as compared with the second heart sound. Now, listen to the sounds of another normal dog recorded over the mitral valve location. The second heart sound is shorter and of higher frequency than the first sound. It is best heard over the pulmonic valve. Listen to a normal dog's heart sounds recorded over the pulmonic valve. Murmurs and variations of the heart sounds may indicate the pathologic condition affecting the heart. A description of the sound is beneficial when making a diagnosis. First, note whether the abnormal sound is present during systole, diastole, or both. Then, determine how long the abnormal sound persists during that phase of the cardiac cycle. While the murmur may be described as occurring early or late, it may also persist throughout the entire systole or diastole and is then referred to as holosystolic or holodiastolic. The intensity of the sound is made by grading it numerically from 1 to 6, or by describing it as soft, moderate, or loud. Notice whether the frequency of the entire sound is high, low, or a mixture of the two. The valve region over which the sound is best heard is another helpful clue.